Good afternoon to everyone on the line. Welcome to today's webinar presentation. My name is Maria Noesi and I will be your host and moderator. Before we get started with today's discussion, I'd like to share a few housekeeping items. First, today's session is being recorded, so please don't worry about taking any notes. We will send you a copy of both the recording and the slides after the presentation, plus any additional resources covered by our presenter. Next, during the presentation, attendees are in listen-only mode. However, we have dedicated time at the end of the presentation for questions. So we encourage you to submit questions throughout the presentation and we'll try to answer as many of them as possible. Finally, for those of you on social media, please feel free to connect with us and submit questions and comments via the hashtag Kognito webinars. Now for today's agenda, our presenter will be discussing what is the HRSA Behavioral Health Workforce Education and Training Program for professionals, an overview of Kognito's online simulations for behavioral health providing training, how does the Kognito simulation support the required grant activities, and an overview of the actual simulations and how they work, followed by a live Q&A. Now with that, I'd like to introduce our presenter. I am joined by Brooke Handy, who is a key account manager here at Kognito. Brooke is passionate about having an impact on healthcare education and brings over 20 years of a career in K-12 teaching and leadership, serving as an administrative faculty in higher education and partnering with healthcare systems. She believes that quality education is paramount to growth and continuous improvement. I want to welcome Brooke. Thank you for being here with us and take it away.
Perfect. Thank you so much, Maria. Good afternoon, everyone. My name is Brooke Handy, and I do serve on the healthcare team here at Kognito. I want to first thank you for your time today, but also on behalf of Kognito, I want to thank you for all you do to lead behavioral health initiatives across the country. We know that your work is important, and we appreciate all you do. So with that, let's dive in. So starting first, we know that many of you are probably familiar with the Behavioral Health Workforce Education Training Program for professionals, thankfully often referred to as the BWET grant, but we just wanted to take a little high level and review that today. So the goal of the HRSA's BWET grant is to increase the supply of behavioral health professionals while improving the distribution of that workforce, ultimately increasing access to behavioral health services. This ideation of the grant, there's a special focus placed on knowledge and understanding of children, adolescent, and transitional aged youth that are at risk for behavioral health disorders. The three overarching goals that are associated with this grant, first, the establishment of relationships with community-based partners that are going to increase quality behavioral health services to those that need it most. Secondly, to promote collaborative training utilizing team-based interdisciplinary behavioral and in primary care settings. And lastly, to recruit a diverse workforce. So while those are the three overarching goals, where we will focus today is with number 2. We would love to share with you what Kognito has to best understand if we can help you support goal number 2 in the collaborative training piece of the grant. So next slide there, great. So some more details here. We know that you're probably familiar with this as well, but what we're excited about is with 92 awards across the country, we know that the BWET grant will continue to impact the quality of behavioral health care across the country. Next slide there, please. So this is where we'd like to introduce you to Kognito if you haven't been familiar with us in the past. Everything that we do here at Kognito, our mission is central. And that mission is to combine the science of adult learning theory, specifically role play theory, with the power of virtual human simulations to inspire behavior change. All of our work is central to that mission. And so what does that look like for clinical solutions? Next slide, please. Well, what it looks like starts with folks like you. It starts with subject matter experts from across the country who are working in the clinical field and have their ears to the ground to let us know what is needed to create virtual patient encounters, let us know the topics and the content that is needed so that we can work to develop with them in mind and future clinicians as well. Next slide, please. So how does that even further translate to our content? So here you will see our entire portfolio for behavioral health and clinical solutions. It crosses across a variety of topics, including community health, pediatrics. We have some new telehealth modules, behavioral health, chronic disease, and interprofessional skills. And while the goal of this grant is very specific, we want you to know that we're here to support you in any of your training needs. So after this session, we would encourage you to reach out and schedule with myself or Dawn on the healthcare team to learn more about what we offer for clinical solutions. However, today we're going to narrow that focus because of the goal in the BWET grant. Look at our adolescent behavioral health simulations. So we have 3 experiences within our catalog that call out and meet that grant goal of serving at-risk youth. The first of which is a 30-minute adolescent risk simulation in which learners practice using therapeutic communication skills with an adolescent patient. The second, there in the middle, that SBI with adolescents, that may look a little different if you've seen it in the past, because we're excited to announce that 60-minute simulation in which learners practice using therapeutic communication skills with adolescents that are exhibiting substance use has also been converted to include a telehealth component. So students are going to be introduced to telehealth techniques in a didactic and practice one of the conversations in that experience. Then lastly, our newest simulation that was co-created with NORC out of the University of Chicago is our SBI with adolescents, comorbid substance use and mental health. And the development of that simulation was truly a call to action. We heard clinicians say we need a client that is a little less compliant, that's a little more of a complex case. So I'll introduce you to Zoe in just a few minutes, but she presents with both co-occurring substance use and mental health concerns. Next slide, please. So the next 2 slides, we want to share with you how our content is crosswalked and shared to the grant program requirements. So I'm not going to go over each of this table because I want to share with you, we've created a resource. If you haven't seen it yet, it will be shared with you in the follow-up once you've registered for this webinar, but it's a grant guide. So we worked very hard to look at the funding announcement and to share the program requirements and how Kognito can help meet those. So all of those are listed in that grant guide. And I just want to call out one thing. As you can see on the first column there, the numbers are skipping some numbers, and that is intentional. It's because there are several program requirements within this grant, and some of those are addressed by the other goals. So stipends for students, some of the community relationships, those are obviously not addressed in what we have. So there's an intentional reason that there's some numbers left missing there. Just to call your attention to one of those requirements, if you'll train your eye to number 5 there, where it speaks to enhancing didactic and experiential training activities, focusing on integrating into primary care. The way we address this is because our simulations are naturally used across multiple programs, social work, counseling, nursing, medicine, they're naturally interdisciplinary. So as you can see on that side there, we do call out that those communication competencies are introduced in primary care settings. Students do not, or learners do not have to have prior knowledge in a particular curricula to be able to complete our simulations. So they're by nature interdisciplinary. Next slide, please, Scott. Thank you. Again, here just focusing in on one of those areas. If you'll look with me at number 8, right there in the center of the screen, one of the requirements for the BWET grant is that you include technology integration by providing options for distance learning and developing didactic and experiential training activities that address strategies for providing telehealth and increasing digital health literacy. Gosh, did we ever hear the call for action to that need this year? And again, as I shared that some of our content has been translated and converted to telehealth, we will show you how that would help meet that need. But again, we worked very hard to crosswalk and share with you this information so that if it helps you in your grant application, that was the goal in mind. So why do we hear that schools are already using our solutions across the country, aside from with grant support? There are 4 overarching reasons. First, it's an experiential learning opportunity. It's practice-based and interactive. There is a small bit of didactic, but a majority of the simulation itself is that application of knowledge. It's that next level of understanding. That is the #1 reason. Second, moving across the screen there, measurable, because we're able to track usage, and some of our simulations have performance dashboards. We have some data that we can share with you. So programs are able to look at how their students or learners are impacted by using the simulations. Moving down there, self-paced and scalable. Again, this year has taught us that we need to pivot and be flexible. That's the nice thing about our simulations. They can be used in a self-paced environment where students can be just given the directions and asked to run. You can use it in a flipped classroom model. You can use it in a whole group and break out to do part of simulation. It is truly flexible to meet your needs and the needs of the changing climate. And last but not least, we have a growing body of research that shows that Kognito is effective. Not only are Kognito users happy with the experience and would recommend it to colleagues, learners feel more confident after completing the simulations, and they also are more apt to refer someone to treatment. So that truly is the goal of our simulations, is the behavior change. If you choose to use our simulations, we're not just going to turn you over to the content and let you loose. We're going to support you along the way. We're going to support you through planning, implementation, training, and reporting. So upon implementation, you're going to be assigned a client success manager. They're going to guide you in implementation. We have lots of resources, including some facilitators guide and some marketing materials so you can share, because we know at the end of the day, if there's not use, there's not the behavior change. So we're going to help you integrate the use. We're going to help with the training piece and the reporting that you'll need. And then we're going to help you with the evaluation at the end. So what does it look like for the next cohort of students? What do we need to change? How do we need to present that differently within your curriculum? We're here to be your partner. Next slide, please. So we talked a little bit about what your client success manager is going to help you do. The reporting and the data, we know that that is important for grantees. One consistent piece of report that you'll always get is a usage report. So we're going to be able to share with you which learners within this cohort have completed the simulation. Some of our simulations also have a performance dashboard. So some of them include a score history report that we're going to share with you. But standardly, across our simulations, we have a pre, post, and follow-up surveys, which are going to help us understand behavior and attitudinal changes. So if we can proceed to that next slide, because we're just call that out here. So the built-in assessments, as I mentioned, all of our simulations have a pre, a post, and a 3-month follow-up survey. And the questions within those survey are really checking on those attitudinal and those motivational changes, and ultimately behavior change. As you can see here on our chart, on the image there on the right, even after 3 months, learners are reporting more patients or clients that they're screening, more that they're engaging in brief intervention, and lastly, more that they're referring to treatment. If I didn't mention this before, this growing body of evidence and this research that helps us document these behavior change, all of that will be listed in the case usage at the end of this presentation that you'll also be shared with as follow-up. So next slide there, please. So now we're going to get to see our solutions are very visual, and so sometimes it helps to see, if you haven't seen before, look at what those experiences truly look like. So we are in our SBI for adolescents with comorbid substance use and mental health, and we're introduced to Zoe. So we have proceeded past the menu, which we'll see in just a moment, but learners get background information on Zoe. They understand a little bit of what the goals of the simulation is itself, and they also get background into her screening results. So we learn here that Zoe has moderate depression, low risk for suicide ideation, and she's been using opioids without a prescription for a few times a week. Just a moment here, we're going to move forward. Here we go. The didactic reviews, the brief negotiated interviewing steps, but learners also get those reported here as a reminder. Lastly, they also get a reminder of motivational interviewing methods before they interact with Zoe.
Hi, Zoe. I'm a colleague of Dr. Fence. Was she able to help you with your cough?
Not really. Said just rest up, hydrate.
I'm sorry we couldn't help more.
Fine.
So a couple things before we dive in. Learners are participating as Sandra here. She's the clinician. But as you can see by Sandra's appearance, as I mentioned before, we tried to make our clinicians agnostic so that social work students, so nursing, counseling, medical professionals can see themselves within the simulation. And so in this experience, they are the driver and they are working as the clinician. And they are working to push forward a conversational pathway that we'll see in just a moment. You also see down here, there is a reminder of the brief negotiated interviewing process. And we're gonna just move forward and see what happens when we choose conversational pathways. So here's where learners get some choice. They can choose to build rapport with Zoe, or they can choose to discuss use. So in the interest of demonstration, I'm going to have that we're going to choose discuss use. So we're going to say that, share with her that she answered some questions. Do we mind if we talk about that?
Earlier, you answered some questions about your health and how you're feeling.
Oh, like the 10,000 questions about drugs and whatever?
That's right. We ask everyone to fill those out. Thanks for answering them.
Sure. Am I in trouble or something?
No, not at all. And everything we talk about here is confidential. Unless it sounds like you might hurt yourself or someone else, or someone might be hurting you, or unless you decide to bring someone else in, I won't share what you say here with anyone. I'm just here as someone who cares about your health.
Okay.
Mind if we talk about your answers?
If you want.
So a couple of things to call out. Our virtual humans are emotionally responsive and have memory. So it's a different experience for each learner. But as the learner experiences, they do feel the way that their choice affects the client or the patient. We also get a little bit of introspection along the way. So kind of to hear what Zoe's thinking after the learner picked that choice. We're going to do that now.
I just came for a cough. Didn't expect to get grilled on some random stuff I said on a form.
So again, the learner felt like that might be the best choice, but maybe Zoe didn't feel as connected. And the way that the learner can know how connected Zoe is, down here at the bottom of your screen, you have an engagement meter. So if we click on that, it's going to let us know how engaged Zoe was with that last conversational choice. So that last choice did increase Zoe's engagement, so it lets the learner know that they were on the right track. Learners can also undo their last choice. We hear from faculty members that often some of their best students use that undo button because they want to understand what would happen if they choose a different conversational pathway or moved to a different part of the interviewing process more quickly. So we're going to continue and choose the next choice. So you can see it kind of drills down, the conversational pathway moves forward. So we're going to continue to discuss use. So here we have the choice that we can ask Zoe about mentioning that she said she took pain pills. What can you tell me about that? Or we're going to choose this one today. You're a good kid. Why are you using those pills?
Good kid. Why are you using pills?
I mean, if someone's passing stuff around, I'm not going to be a buzzkill.
Do you take them on your own? Well,
maybe a couple of times.
So again, that emotionally responsive, and I chose that choice because I wanted to bring out your virtual coach down here. So along the way, this is some scaffolded learning, and as students veer down maybe not the best conversational choice, they'll get some support from their virtual coach. So if we click this option down here at the bottom, we'll see that it reads that your question implied you were judging Zoe's choice to use pills, and it showed her it wasn't safe to open up. So guiding students so that when they go to choose the next conversational pathway, they'll have guidance into that. Again, we can look at the engagement meter here. It decreased Zoe's engagement. So just that learning, that practice learning experience is valuable to students. Learners will proceed through the simulation until ultimately the goal is to refer Zoe to treatment. And I'm going to move back here. Let's see, I can't quite see. I want to show you the menu. Scott, you may have to help me there. I think it's maybe my me see if there we go, perfect. Sorry guys, I think my picture at the top was cutting off part of my screen. So I do want to show you what the experience looks like itself. Each of our simulations look very similar, where students are going to come, or learners are going to come into a menu. So each is presented with a didactic. The didactic for Zoe is the complex case. It's going to review with them some best practices in addressing an adolescent with multiple concerns. All of our experiences have some type of practice. Again, this is the true value add here when they're practicing those conversational skills, and those look different in each of our simulations that we're happy to share with you. And if you could scroll down for me a little there, Scott, there's a dashboard in this experience. It does vary, and we'll share that with you, but learners are going to get feedback and to know which part of the brief negotiated interviewing process they did well, and perhaps maybe there are some that they need to work on. Lastly, there's some closure. They'll understand what Sandra did to refer Zoe to treatment and receive the brief intervention. I mentioned when we looked at the support that's available, we're not going to click on it today because we're absolutely happy to share these with you, but there's a section under additional materials and resources. That's where our facilitators guide. We worked very hard to create some materials that help with implementation. Our facilitators guide has been fleshed out with support to use the simulation in a variety of ways, including additional activities that can be bookended around the experience itself. So we are happy to share those with you, but we did just want to do a short demo. And I think with the remaining time that we have, we wanted to make sure we left some time for questions. So we can pop back out to that.
Beautiful. Thank you so much, Brooke, for that overview and for giving us a glimpse of how the simulations work. Again, I want to invite our attendees to submit questions for Brooke, and I'll start with a couple that have come in. Brooke, if you don't mind, some folks joined a little bit later, recapping how Kognito supports the program requirements, and perhaps we can jump to that slide where you went through that, but a little bit of just a recap on that piece.
Sure. Yeah, let's start there. So I first want to go back even further to say that we started with this by talking about the grant goals, because there are three overarching goals. It's to increase the community relationships, which impact field field experience, to promote collaborative training, and to recruit a workforce. So where we live at Kognito, what we're looking to support grantees or those that are looking to apply for is that collaborative training piece, because it does call out integrating telehealth techniques. It calls out integrating didactic and experiential learning. We feel that what we have at Kognito crosswalks that and addresses that. Scott, if you want to proceed forward to the piece of the grant guide, that would be fabulous. So I'm not sure how many folks were here for this, but we have a grant guide that we will follow up with that fleshes all of this out, that speaks to, again, under that view of training, the training piece of it, how Kognito training calls out the program requirements listed in the BWET grant. So here we didn't go over each of them, but they are found in that grant guide, but it speaks to, again, integration of behavioral health training. Our training pieces are able to do that. They're often used in interprofessional experiences. We now have a telehealth component to one of our simulations that has an adolescent focus. We can just look at that next slide there as well, Scott. I'm just kind of scanning over this, talking about speaking to the knowledge and skills around individuals with mental disorder symptoms, specifically children. Again, we're going to guide you and suggest the adolescent experiences that we have available, because that is called out in the grant. It applies SBIRT technique, so it is a practice that is very reputable in the behavioral health field. Lots of ways that you can crosswalk the training to the requirement of the training of the BWET HRSA grant.
Thank you so much, Brooke. And the next question that has come in is, what is the cost of the simulations for those who are interested?
Perfect. That's a great question. And what we would invite you to do when you're ready is to book an appointment with Dawn or myself, because it really is going to depend on how many students you're looking to train, what your budget looks like. Are you looking to implement this, pay for it all in 1 year? Are you looking to use it each of the 4 years? So there are lots of variables. Are you looking to use all 3 of those simulations? Is there another simulation from our suite of products that you would like to pull in? There's a lot of variables, and we want to do our best to serve you well, and sometimes that takes an individual basis. So I think it's a great question. It's always one of the first that we get. So we want to hear what you need first and then be able to support you. Let me also just add on to that. We know if you haven't already completed your application that time is of the essence. And so our goal is to make this a priority. When you need something for that application, we're making it a priority to get you whatever you need, whether it be a formal quote, whether it be a proposal, whether it be some language that you need to help you with your application. We are going to make this a priority.
Thank you for adding that, because a couple of questions have come in around how they can incorporate Kognito into the grant. And I think to what you've said is just reiterating that one-on-one conversation and how Brooke and Dawn on the team can help tailor that for your specific needs, so that it's not a one-size-fits-all approach for the grant application.
Absolutely. I think that really does address. We want to hear what your needs are, what you're, as a subject matter expert, what do you see as far as training needs, and then crosswalk that to how we can best serve you.
Perfect. So with that, we're actually going to conclude the session. If there are follow-up questions for Brooke, her contact information is on the screen. You can reach out to her via email. We are going to be following up with the recording of the presentation, the slides, the grant guide that Brooke has mentioned, linked to a simulation that was covered today so that you can experience that for yourself. And again, Brooke's contact information in the case that you're interested in following up. But I want to thank Brooke for her time this afternoon, and all of you who joined in to listen in. We wish you the best of luck in your grant application, and let us know how we can help. Take care.